So hey everyone, today we are about to discuss about lungs. So first of all, the lungs is an organ of respiration. It is present in the thoracic cavity. Okay, so there are two lungs, the left and the right. They are separated through the mediastinum. Okay, so the lungs is divided by some fissures into lobes. Okay, likewise in your liver, we have seen that in the liver there were several fissures which divide the liver into several lobes. Similarly, here also in the lungs, there are several fissures which divide the lung into various lobes. Okay, so lungs are soft, spongy, and elastic. This is some basics basics of the lungs. Okay, so lungs crepitate or produce some cracking sound when pressed. Okay, so when the lungs is pressed, so they produce some cracking sound or they crepitate. Okay, so in the fetal stage, they do not crepitate and they shrink in water. Okay, this is some info about the lungs. Okay, so the lungs have the ability to flow in the water. If we put the lung into in the water-filled bathtub or something, so you will see that the lungs can flow easily on that watery surface. Okay, now, in fresh stage or the fetal stage, the color of the lung is slightly pinkish. The color of the lung depends upon the amount of the blood vessels present there. Obviously, the amount of the blood vessels or the blood supply there in the lungs will only define how much the coloring of the lung is. Okay, so that defines the how much the color of the lung is. Okay, so this was all about the lung color and all. Okay, so the weight of the lung is about 3 to 3.5 kg. Okay, so here you can see the lung. We will come back over here to discuss something. Okay, so coming on to the left lung. So left lung is divided into three lobes: the apical, the diaphragmatic, and the cardiac. So here in this picture, you can see this is the left lung, which is divided into apical, the cardiac, and the diaphragmatic lobe. So there is three lobes, the first, the second, and the third lobe in the left lung. Okay, so the fissure which in the left lung divided the left lung into three lobes, the apical, the cardiac, and the diaphragmatic. Now, coming on to the right lung, it is larger in size as comparison to the left lung. Okay, so it is it weigh extra half times of the weight of the lungs. Means if the weight of the right lung, this is the weight of the right lung. Okay, weight of right lung plus half into weight of left lung. So this is the total weight of right lung. Okay, so the actual weight of the right lung plus the half of the weight of the left lung is the total weight of the right lung. So this is what we see. Okay, so means it weigh extra half a times of the left lung. Okay, means जो भी lungs का weight है उसके आधा गुना extra ही है weight right lung का. Okay, now it have an additional lobe or the intermediary or accessory lobe. Okay, so the right lung have an extra lobe which is known as intermediate lobe. Okay, the apical lobe is divided into anterior and posterior by the fissures. Okay, anterior and posterior divisions होते हैं apical lobe के इसमें और वो भी fissure के द्वारा ही किए जाते हैं. Means they are also divided by a fissure. Okay, the apical lobe receives an extra special bronchus known as apical bronchus, okay, at the level of third. So this point is quite important because in case of ruminants only, majority ruminants, the apical bronchus is present, which divides at the level of the third rib to give supply into the apical lobe of the right lung. So here in this image, you can see that this is the apical bronchus, which just opens into the apical lobe. Okay, so this is the cardiac lobe of the right lung, intermediate lobe, which is in, or you can say, accessory lobe, and this is the diaphragmatic lobe. So the dorsal border of the right lung is longer than that of the left lung. Okay, so there are two borders, two surfaces, apex and base. Okay, so first of all, we are going to discuss about the lateral or the costal surface. So this surface faces the wall of the thorax and ribs. It is convex and attached to the ribs. So it is the outer surface which faces the thorax and the rib. Okay. Now coming on to the medial or mediastinum surface. This surface is towards the mediastinum and in contact with the mediastinal pleura. Okay. An impression is present on this surface known as cardiac impression, and this is for accommodation of the heart there. Okay, so in the medial surface, there is impression present which accommodates the heart. Okay, the cardiac impression is larger and deeper in the left lung as the heart is slightly shifted towards the left side. Okay, so above this impression, there is hilus of the lungs. Okay, hilus of the lung from where the brachial artery and all the pulmonary artery they all enters the lung cavity. Okay, above the impression, the hilus is present, okay, in the lungs, which gives entry to the bronchi, bronchial artery, pulmonary artery, vein, nerves, and lymphatics, okay. So it is just an opening point from where all the arteries, veins, and the lymphatics or the nerves enter into the cavity of the lungs, okay. On the dorsal third of this surface, there are two grooves. So first one is the upper groove, second is the lower groove. So the upper groove give accommodation to the aorta, while the lower groove gave accommodation to the oesophagus. So, in the right lung, in between the diaphragmatic and the intermediate lobe, there is a groove present which lodge the posterior vena cava. So, in between the intermediate and the diaphragmatic lobe of the right lung, there is an extra groove present. Okay, so there is a presence of a groove which lodge the posterior vena cava. Okay, now coming on to the dorsal border of the lungs, so it is thin and sharply anterior, sharp है anterior के side, okay, thick and rounded posteriorly. So the dorsal border of the right lung is bigger than that of the left lung. So now we are about to discuss the ventral border. So ventral border is thin and sharp, shorter than that of the dorsal border. Dorsal border से छोटा है. And there is a present of the cardiac notch, okay, from where the pericardium get exposed. So the pericardium, the outermost layer of the heart, get exposed through this cardiac notch area, which is present on the ventral border of the lungs. Okay, so there are obviously left cardiac notch and the right cardiac notch. It is larger and present at the level of the third and the fourth intercostal space, where the pericardium of the heart is in contact with the wall of the thorax. Okay. Now the right cardiac notch, it is the pericardium covers the lungs. Okay, and it is small. Okay. Coming on to the apex of the lungs. Okay. So the apex of the lung is present at the level of the first rib or the thoracic inlet. Okay, at the level of the thoracic inlet, the apex of the lungs are present. Okay, for the left lung. Okay, so there are difference between the apex of the right lung and the left. So consider this as the thoracic inlet. Okay, so the apex of the left lung. Oh, sorry, right lung. Apex of the right lung and the apex of the left. So you can see this is the level of the first rib, while you can clearly see the right lung apex is extending above the first rib or the level of the thoracic inlet. Okay, so the apex of the right lung is extending above the first rib. Okay, so that's the peculiarity of the right lung apex. Okay, the anterior border. Okay, so from here, but in the case of the right lung, it crosses the anterior border of the first rib and extends cranially. Okay, it is extending cranially. It is thin, narrow, and flattened from both sides. Base. It is concave, broad, oval shaped, present in the front of the thoracic face of the diaphragm. So if this is the thoracic face, this is the diaphragm. This is the diaphragm. So this face is the thoracic face. Okay. So here if this is the lung, so this portion is the base of the lung. Okay, so the base of the lung is concave, broad shaped. Okay, present in front of the thoracic face of the diaphragm. So about the first of all, there are two arteries entering into the cavity of the lungs. So the very first artery is the bronchial artery, second is the pulmonary artery. The bronchial artery provide nutrition to the lung. All the cells of the lungs get nutrition from the bronchial artery, while the pulmonary artery is the functional artery in case of the lungs. Okay. Now coming on to the species difference. So in the case of horse, there is no division in the lobes. Okay. So there is no lobe division in case of the horse by the fissures. Okay. So lungs are comparatively larger. So the left cardiac notch is quadrilateral in the shape. Okay, we have seen that in the ventral border there are two notches, the cardiac left and the cardiac right notch. Okay, so the right cardiac notch is small and triangular. Now about the dog, so there are deep fissures, short, wide lungs. Okay, extend up to the hilus. Each lobe appears to be indistinct. The cardiac compression is deeper in the right lung. Okay. So what we have seen earlier that the cardiac compression was deeper in the left, okay, but in case of the dog, the cardiac compression is deeper in the case of right lung. So this is important. Now we are about to end this lung topic. So the right cardiac notch is triangular and comes in contact with the thoracic wall at fourth to fifth intercostal space. Twigs lobulation are indistinct. The right lung have four lobes. Apical bronchus is present. Okay, you can mark this that the apical bronchus is present. Okay, so this point is important. The apical bronchus is present only in ruminants and pig. So coming on to, about the fowl, there are the 11 air sacs present. So from which there are two cervical, clavicular 1, axillary 2, and 6 thoracic. And thoracic is divided into three regions, the anterior, posterior, and the abdominal. So 2, 2, 2, 2, 2, which is 10, and 1 is 11. So there are total 11 air sacs. So it is present in the dorsal wall of the thorax, adherent with the rib. Costal impression is deeper. Air sacs and the bladder-like receptacles with the delicate walls. The contact of the air sacs. Okay, so the air sacs are in contact with the pneumatic bones and the bronchus. So the thoracic air sac do not communicate with the pneumatic bones. So we have seen that this thoracic air sac do not communicate with the pneumatic bones. So all the pneumatic bones present in the fowl, obviously the pneumatic bones carries air in their spaces, right? Because the all the lobes or the air sacs that we have seen, they will communicate through the pneumatic bone, but the thoracic air sac do not communicate with the pneumatic bone. Okay, so the basic unit of the air exchange in the fowl is air bronchi capillary. So this was all about the lungs.